Hello everyone and welcome to the Alzheimer Europe conference. My name is Kielan Building and I work in the policy team here at Alzheimer Society. Today I'll be talking through our project, which is building the Dementia Pathway, which is a long-term project looking at the quality of and access to health care and support. With this project incorporating the provision of care for people with dementia from diagnosis all the way through to end of life. So the supporting premise behind the Pathway project is the widely held view that the current provision of care for people with dementia is inadequate. People are often unaware of the services available to them that would enable them to live well with dementia, or that they bounce between service to service, meaning people fall through the gaps in the health and social care system. So the aim of the project then was to identify where current gaps in care and support exist for people with dementia, as well as identifying good practice within the dementia pathway. In terms of our outputs, we released a report on the dementia pathway back in October 2019. And here we looked at what care and support people with dementia and their carers are entitled to according to national guidance and legislation. And we benchmarked that against the care and support people are actually receiving. And I'll detail some of the key findings of the report in the next slide. But just to mention that following the report, we plan to conduct deep dives into different parts of the dementia pathway, such as diagnosis, post-diagnostic support and end-of-life care. And again, I'll detail some of these plans in the following slides. So as mentioned, the first output of the project was our Dementia Pathway report, titled From Diagnosis to End of Life, the Lived Experiences of Dementia Care and Support. It explored in detail what healthcare guidance and legislation say people in England should be receiving at each stage, and therefore the care and support that they say will enable people to live well with the condition. We then conducted a gap analysis by benchmarking this against the experiences of people affected by dementia. A key finding of the report is that people aren't consistently receiving good quality integrated care and support that enables them to live well. Too often we found people's pathways were fragmented, often accessing services after a crisis, or they had bounced from service to service with a lack of coordination around their care. So for instance, at the beginning of the pathway, we had stories of people struggling to access a diagnosis. But once people had a diagnosis, we heard people struggling to access person-centered post-diagnostic support. And then towards the end of the pathway, we heard of people not receiving proactive and effective palliative and end-of-life care. And given this poor quality and fragmented provision of care, the recommendations, which are targeted at both local and national decision makers, are therefore focused around upskilling staff and integrating services. The first deep dive of the project looked at increasing access to a dementia diagnosis across three separate themes. So reducing regional variation of diagnosis rates, supporting people from ethnic minority communities to access a diagnosis, and improving access in care home and hospital settings. The key finding we found from our regional variation report was that diagnosis rates are affected by both regional factors, such as deprivation and rurality, as well as the systematic processes within the diagnostic pathway, such as case finding for dementia and referral processes. A key finding from the ethnic minority report was that people from these communities experience an inequity of diagnosis, either receiving one late or not at all. And it's both the barriers that exist within communities, as well as the service level barriers that contribute to this inequity. And finally, a key finding from our care homes and hospital report was that challenges exist for services and staff as well in the identification, assessment and diagnosis of dementia in these health and care settings. So we are currently undertaking a deep dive into post-diagnostic support. So through extensive engagement with people affected by dementia, GPs, commissioners and memory services, we hope to understand what people want from post-diagnostic support and to identify what is important to them. But not only this, we'll also look at to understand the experiences of people in their assessment of post-diagnostic support and whether their needs are actually being met, and where their needs aren't being met, the potential impact of this on the person, their families, as well as the wider health system as a whole. And finally, just as part of this deep dive, there will be an explicit focus on the experiences of post-diagnostic support for the South Asian community. And once this post-diagnostic support deep dive has been completed, we will then begin a deep dive on end-of-life care toward the end of 2022. So that brings me to the end of my short oral presentation. I'll leave my email on the slide, and I welcome any questions to be sent to me through there. So thank you for listening, and I hope you enjoy the rest of the conference.